Assalamu alaikum. Today I am going to describe the topic on investigating the postcoital bleeding. This topic has been taken from the TOG article in 2022, published in the 2022. So postcoital bleeding means the bleeding after sex. What is its incidence? It affects 1 in 10 women. For the most women, the cause will be unrelated to the cancer, but the likelihood of cervical cancer being the cause increases with a woman's age, although the risk remains very low. The main aim of investigating a woman with postcoital bleeding is to rule out cervical cancer. So, any woman who present to you in the clinic or in the ward with history of postcoital bleeding, you have to take a thorough history that may covers the patient age, bleeding, their duration, frequency and amount, menstrual history, other gynecological symptoms like vaginal discharge, pain in lower abdomen, use of contraception, human papillomavirus immunization status, cervical screening history, sexual history, whether any pain, whether this is first time, relevant past medical and surgical history, any medications, risk factors such as smoking. So most invasive cancer that cause the postcoital bleeding are obvious upon speculum examination. So on examination, we have to go systematically. On the abdominal examination, might be there is a pelvic masses. On vulval scans, when we see the local examination, there may be the findings of the dermatosis, excoriation to rule out the other causes of the postcoital bleedings. Any ulcer, fissuring, female genital mutilation, any piercings. On vaginal wall, look for the atrophic changes, lacerations, any prolapse, ulcerated lesions, discharge, or a foreign body. On a speculum examination, cervical ectopy or a polyp. The findings suggestive of the cervical cancers that are ulcer, flammable tissues, contact bleeding, and irregular mass. So these are the findings that may suggest of the cervical cancer. Usually, the most invasive cancer that cause postcoital bleeding are obvious upon speculum examination. So these are the findings. These are the findings which may show or favors towards the cervical cancer. So if any of the findings are present and there is unexplained postcoital bleeding or persistent vaginal discharge, if any of these findings are present like ulcer, flammable tissue, contact bleeding or irregular mass or unexplained postcoital bleeding or persistent vaginal discharge, refer this woman for colposcopy within 2 weeks. So refer this woman for colposcopy within 2 weeks. If any abnormal result obtained is a part of the cervical cancer, go to this. If any abnormal result obtained on the cervical cancer screening program, refer for colposcopy. Abnormal results on National Cervical Screening Program, refer for colposcopy within 2 weeks. For other signs and symptoms, mean to rule out the other causes, we can perform microbiological swabs, stereoscopy, screening for domestic abuse, transvaginal ultrasound, and papal biopsy. Remember the other causes of postcoital bleeding. It's not necessary that every postcoital bleeding is cancerous. The other non cancerous causes of the postcoital bleeding include cervical endometriosis, genital ulcers, bleeding disorders, sexually transmitted infections, vulvovaginitis, benign vascular tumors, genital warts, trauma, any sexual abuse, foreign bodies, cervical or endometrial polyp, cervicitis, genital piercings, female genital mutilations, and pregnancy related. So, for to rule out these causes, we have to go for these investigations too: the microbiological swabs, stereoscopy, screening for domestic abuse, transvaginal ultrasound, and Bible biopsy. Thank you. Thank you for listening. For more videos, like, share, and subscribe my channel.